Over the last 10 or 15 years, I suppose I've seen hundreds, maybe even over 1,000 patients with fibromyalgia, both in Northern Ireland and when I worked in England. It's a common condition and it's increasingly diagnosed, and I think people are increasingly being sent to hospital as well with the condition.
Well, it's almost 5 years ago now. I was taken into hospital with extreme vomiting and diarrhoea, which they couldn't explain, and just put it down to a virus, and I went back to work, and within 2 weeks I literally had to leave work one day. And I went home and I didn't wake in for 18 hours, and that's when it started.
Fibromyalgia, it's a complex condition and it affects different people in different ways. I tend to think of it in 3 big sections. One is people complain a lot of tiredness and sleep problems. Secondly, people complain of muscle pain, muscle aching, muscle burning. And thirdly, there's a range of other symptoms which are probably related to those two. For some people it's problems with their memory, for some people it's feeling depressed, bursting into tears at times. For other people it's tingling in the hands and the feet, it's irritable bowel symptoms. I think those third group of symptoms depend more on the patient's personality and circumstances, but the 2 big groups are sleep problems and tiredness and muscle burning and muscle aching.
Fibromyalgia has changed our whole lifestyle. As I said beforehand, we would always have sort of done things together, and we'd have been out together and going places and even going on a holiday together. So the family have had to take on the duties that I would have been doing before, the cleaning, the dishes, the shopping, and that's really difficult. It's difficult, and I was always a very independent person, and I didn't like other people doing what I thought to be my role, and have to sit back and, you know, ask your 11-year-old child to make you a cup of coffee because your hands are so sore you can't actually lift the kettle yourself. I mean, that's just... Or, you know, when Joshua was younger, you know, when he was 6 or 7, when this was only starting, you know, running over to jump up on me and give me a hug, and then, you know, pushing my own child away because I can't hug him because it hurts.
Well, my role of carer is well, to basically do all of the things that she is no longer able to do, you know, dishes, shopping, I suppose breadwinner in a way. The money is an issue because with her qualifications she was a significant earner in the household, and now it's very hard to make ends meet. So it's basically a lot of the roles have changed. Basically everything's changed. It's on a bad day, she can't do anything, and that has to be done, and that's just how, you know, we move forward. Just have to approach every day differently as it comes.
I need to write lists about lists, and then I have to write lists to remember where I put the lists. It's commonly referred to as brain fog, and it's really annoying because my brain was, I wasn't blessed with beauty, but I had a bloody good brain, and it doesn't work anymore. I wear loose clothes because my skin hurts. So some people are of the idea that it's the whole body becoming super sensitive. I'm very outside in any light at all. I would have to wear sunglasses. My hearing is very acute. My nose is, it's unreal. The tiniest little change of the scent in a room and I will smell it.
How's your vision?
My vision has got worse. I have got That's brain fog. I can't get the word out. Oh! I spoke at seminars, I managed people, I ran businesses.
Mum can't really go for a big shop in Tesco's anymore. She'd go for smaller shops because of the pain of walking around, and she hasn't worked in ages, so she relies on us to do more around the house for her. And she would normally, she'd sleep a lot during the day and we don't get to do as much.
I never really had a very good sleep pattern. I never needed much sleep. I was very much on the go. Now, the most I can sleep is about an hour and a half, 2 hours, and then it's awake, and then it's back to sleep, and then that will go on for a few days, and then eventually it'll be unconscious for 12, 15 hours, and even then waking up and feeling as if you just haven't slept for 5 minutes.
Research tends to suggest in fibromyalgia that problems with sleep are actually near the core of what's causing the condition. There are different levels of human sleep, and patients who never get below level 1 or 2 sleep, their sleep is restless, they wake feeling unrefreshed in the morning, and that seems to be the sleep pattern that people with fibromyalgia have. By contrast, level 4 or 5 sleep is when you feel unconscious, you wake up feeling wonderful and refreshed and ready for another day. And fibromyalgia sufferers very seldom report that that's the pattern of sleep that they have. The brain needs sleep to feel refreshed, to regenerate levels of various chemicals, and it seems to be that because fibromyalgia sufferers never get fully refreshed, that they feel so rotten, so lousy during the day. That manifests itself as burning, aching in the muscles, the feeling that you're always suffering from the flu, difficulty carrying out just day-to-day tasks. And that can vary from day to day as well. And certainly if other stresses or other illnesses intervene, then it can make things a lot worse for people.
Attending cognitive behavioural therapy to try and sort of deal with the frustration, to try and give me some acceptance of my limitations, to try and deal with sometimes fairly constant pain, which triggers depression, and then that's just a vicious circle, and then any sleep that I may have been getting doesn't happen, and all those increase the pain level and blah, and then you're just in that situation. That has happened before. I have attempted suicide as a means of getting out, because there is nobody or nothing that seems to be able to relieve the pain.
My grandmother can get away and do a lot of the things that she's, on a bad day not able to do anymore.
Took away my life, basically. I know to some people looking in, they would say, oh, well, you're still able to do this and you're still able to do that, and on a good day you can actually go up to town and have a cup of coffee, so it could be worse. But prior to this, I was, as a single parent, my own home, working a full-time job, doing a degree in my spare time, and involved in charity work, and just like go. To the people that can do those things, they probably just take them for granted. But when you can't do them, and there's nothing you can do about it, and you can't go to the doctor and ask for a painkiller because there isn't one, you can't, give me a prescription. There isn't a prescription, there is nothing. Nobody has, I don't even know what caused it.
The swift decline at which, that the whole thing happened is probably the hardest thing to deal with. I mean, 4 years ago, she was a vibrant, busy, always energetic woman, and then in such a short period of time becomes, lethargic and just almost a completely different person compared to, what all of the things that she was capable of before.
I think some of the problem with the condition is that people feel they've been floored by it, and they're not necessarily getting a lot of support or help from the medical profession or from others. This is something that you do need to feel you have a chance to fight against. So find some sort of exercise that you like doing, make sure it's enjoyable, and there's good evidence that that will stretch out muscles, that it will improve the quality of your sleep, and that most people with this do improve over time. That would be my experience.